Okay, good morning, everyone. I think we'll make a start. So hi, everyone. My name is Will Clark. I'm the Executive Director at Healthcare Without Harm Europe. And it's my really very great pleasure to welcome you to this morning's session. It's fantastic to see so many people in attendance. We've got a very, very high number of people attending, so that's fantastic. And, you know, we're super excited this morning at Healthcare Without Harm Europe because we're here to launch our landmark publication, Designing a Net Zero Roadmap for Healthcare. And this has been developed through our Operation Zero project in Europe that I know a good number of you on in the session have been involved with. And it really marks the culmination of over 2 years' work, really, when we factor in both the planning and delivery phases. And it's a publication that has been developed in collaboration with national and regional health authorities across Europe, and we're going to hear from them today. And it's really been developed by the health sector for the healthcare sector. So it's, you know, it's a very hands-on and practical resource that's been designed with the needs of the healthcare sector front and center. And you're going to hear a lot about that today. And of course, this publication is very timely. You know, we're seeing a growing momentum in delivering climate smart healthcare internationally. The COP26 health program has led over 50 countries around the world to commit to low carbon, climate resilient healthcare. 9 of those countries are in Europe and are in attendance at today's session. So that's really fantastic. And I think for us, you know, making these commitments has been a really bold and important first step. But what we really need to see now is a concerted effort to move from commitment into action. And this publication, Designing a Net Zero Roadmap for Healthcare, has been developed to support in precisely that process. So, you know, this is a critically important moment for the healthcare sector in the context of climate action, and that makes this publication really an unmissable resource for those tasked with setting their healthcare systems on a net zero pathway. So I think let's get into the session. So in the interest of time, we're not going to be having a moderator today, so each speaker will be handing over directly to the next. We will be recording the session, just to let you know, so if any of your colleagues haven't been able to join or you want to rewatch the session, then you'll be able to do that. We'll make that available, and there will be a Q&A at the end, so please do add your questions into the Q&A panel and we will try to answer them as we go along. We'll certainly pick them up at the end. So with that, I'd like to now introduce and hand over to Vladimir Kondrovsky from WHO Europe, and he's going to deliver our keynote presentation this morning. So Vladimir, I'll hand over to you.
Good morning, and thank you, Will. Thank you for being here today. I'll try to share my presentation first. Yes, and thanks to organizer definitely for the invitation and opportunity to participate in this webinar on behalf of WHO. I will start with the big picture, because the signals about what human activities have done to the environment becoming increasingly real. Of course, the global temperature each decade in the last 50 years is hotter than the previous one. And we know that more than half of the observed increase in global average temperature was caused by elevated emission of carbon dioxide and other greenhouse gases by humans. But as you see on the right-hand side figure, there are no good news for the future. It shows the projected trajectories of global warming in coming decade based on the actions we intend to implement now. So you see several scenarios, and also we have already reached 1.2 Celsius of global warming, and as we see from the latest IPCC report, the case for action is irrefutable. So that means that from one side, the cumulative scientific evidence is unequivocal that climate change is a threat to human well-being and planetary health. But as from the report from IPCC Working Group 3, the economic benefits in human health from air quality improvement only arising from mitigation action can be of the same order of magnitude as mitigation costs, and potentially even larger. So a much stronger policy and action are needed to effectively change the trajectory of this emission. And just to know that just to limit warming to 1.5 degrees Celsius as Paris Agreement target, emission needs to drop by 45% by 2030. So we have to increase our ambition, and that's why we, as WHO, support all action from our partners to work together to achieve this target. Because this is important, as a climate change is already impacted health in a myriad of ways, including by leading to deaths and illness from increasingly frequent extreme weather events, and particularly in Europe, the heat waves are the most deadliest one. We have a lot of storms, a lot of floods, and then some disruption of the food system with droughts, as we face this summer, for example. Then we see increases in zoonosis and food, water, and vector-borne diseases and mental health issues. And furthermore, the climate change is undermining many of the social determinants of good health, such as livelihood, equality, and access to healthcare and social support structure. So this is the figure from our latest COP26 health program publication, and it summarizes the connection between health and climate change. So in the short to medium term, the health impacts of climate change will be determined mainly by the vulnerability of the population, the resilience to the current rate of climate change, and extent and pace of the adaptation. But in the longer term, the effects will increasingly depend on the extent to which transformational action is taken now to reduce greenhouse gas emissions. So that's why we, as WHO, think that that there are three tasks for public health, because the health sector needs to help reduce carbon emission to promote health, make health system more sustainable, and protect health from full range of climate risk. So I will try to go in at least with some notes for each of them. Regarding the health reduced carbon emission for promoting health, in particular air pollution, we know that the sectors that produce most greenhouse gas emission, like energy, transport, industry, agriculture, and waste management, are also the main sources of fine particulate matter and other important air pollutants. Over 90% of the people breathe outdoor air with pollution levels which exceeding WHO air quality guidelines values. And 2/3 of this exposure to outdoor pollution result from the burning of the same fossil fuels that are driving climate change. So mitigation promotes healthy well-being, and it is imperative for reducing the impact of climate change. For that reason, and after systematic review of the cumulative evidence, WHO updated our air quality guidelines last year, and in particular levels are now lower than 15 years ago. Because by reducing greenhouse gas emissions, we can have the substantial health benefits from reduced air pollution. This is some tools we developed to support our member states in the efforts to link climate change mitigation, air quality, and health. Our new climate QH tool will be launched in October. It is formally Carbon H, a tool to quantify health and economic effect of climate change mitigation through air quality improvement, and well-known AirQ+, a tool for health risk assessment of air pollution, and to support countries to estimate based on their needs. So generally, to make health system more sustainable, the health sector needs to reduce greenhouse gas emissions from its operations, contributing to mitigation efforts, and it has to adapt and become resilient to climate change, because the health system and healthcare facilities are our first line of defense against climate-related shocks and stressors. And at the same time, the operations often impact the environment and population health with unsustainable practices related to water, sanitation, waste, energy use and procurement and supply chain. So that's why reducing greenhouse gas emission from its operation, contributing to mitigation efforts, and the facilities, the healthcare facilities can lead by examples. And based on the healthcare without harm data, we know that the health sector accounts to 10% of global GDP and is a sustainable contributor to greenhouse gas emission, accounting for around 4 to 5%. Also, WHO published several publications, the WHO guidelines for climate resilience and environmental sustainable healthcare facilities, together with the checklist to assess vulnerabilities in healthcare facilities in the context of climate change. And we in WHO European region have also supporting our European view on environmental sustainable health systems. I will just here try to give one example from a checklist of the vulnerability checklist, how to assess it in different domains. Here is the example of energy. And on the right-hand side, you can see in the figure what intervention might be considered. So it is very useful tool also for countries to make their vulnerability assessment. But the third one is definitely the one which, because health sector needs to adapt and become resilient to climate change and protect health from full range of climate risks like extreme weather events, infectious diseases, and others. There are many examples how they can do by using climate information to improve diseases surveillance, for example, and response, or develop a heat health action plan, or make climate facilities more resilient to floods, but also they can reduce the environmental impact of their operations. And the health workforce, they can train the health workers and they can be engaged on climate issues. So climate action represents an opportunity to harness synergies to improve healthcare services and infrastructure from one side, but from another side to integrate health in climate action and scaling climate action for health. And so we can start from the global one, where WHO supports a lot of global and regional frameworks. It was mentioned the COP26 health program by will and participation on the from the European country, because this program was calling upon health leaders to lead by example and invite them to sign up commitments on establishing the climate resilience health system and sustainable low carbon health system. But also as a follow-up at the global level, we established the new WHO Alliance for Transformative Action on Climate and Health together with partners, among them Healthcare Without Harm, which aims to bring together the countries which have signed the health program commitments to progress and drive this agenda forward and to promote accountability, definitely. So I will, because I'm based in European Central Environment and Health in Bonn as part of WHO Regional Office of Europe. We provide as an office evidence-based policy advice. We generate evidence on the healthful benefits from decarbonization. We offer guidelines and tools, support countries in building climate health system, advocating for health consideration, and definitely support countries in achieving their commitments. But we also a secretariat of the working group of health and climate, a political one under the environmental health process, and which aim in effect to support and it's promote communication and collaboration among member states in Europe and stakeholders together to address the health challenges caused by climate change in our WHO European region. And I would like to finish my presentation by promoting one of our what we call the role model for across the region. It is our zero regret paper, what we developed together with our partners, because it's aimed at policymakers, particularly from the health sector, to equip them with evidence and message to support an active engagement in national preparatory consultation and collaboration across sectoral boundaries and social actors. But as I said, it is our role models to support the formulation of key health messages towards the regional committee of WHO Europe, but also towards the new ministerial conference on environment and health, which will be held in July next year in Budapest. I would like with this to finish, and thanks to the organizer for the invitation, because the climate change as a public health crisis calling for coordinating transformative efforts, and you are launching of the publication in one of them, so we can only make joint efforts and do a collective action to achieve our target. Thanks a lot.
Great, thank you very much, Vladimir. So that kind of hands over to myself. So I will share my screen as well. Okay, so hopefully that is presenting okay. So thank you very much for that, Vladimir. So my name is Scott Brady. I am the Climate Programme Manager for Healthcare Without Harm in Europe. And I've also, from a Healthcare Without Harm point of view, I've been the project manager for this Operation Zero project. So it's kind of down to me, I guess, to give an overview of what the project was and what it was all about. And then I'll hand over to some of our partners to give a bit more detail around the methodology and the experiences and so on. But to kind of introduce the project, what I wanted to do is firstly, every good superhero needs a good origin story. So I wanted to give a bit of outline as to where this project came from, essentially. So I guess the kind of embryo started around about 2019 when we published our climate footprint report, and that gave us some really nice high-level figures. It was one of the first, and certainly one of the most comprehensive measures of the global footprint of healthcare in terms of greenhouse gas emissions. There were some very key kind of findings that came from that. So 4.4% of global net emissions belong to the healthcare sector, and if it was a country all by itself, then it would be the 5th largest emitter in the world. So that gave us a really good grounding in which to really launch a lot of the work that we're doing now. And then we carried on. So through that climate footprint report, we got the measure on various countries' footprints and so on, but it was still very high level. We were looking at scope 1, scope 2 emissions, scope 3 emissions as well. We weren't necessarily looking at the granularity or what we could do. So the evolution of this, if you like, is from last year. So in 2021, we published the Global Roadmap for Healthcare Decarbonisation. It was the first roadmap for healthcare. It was a global level, and it did demonstrate that zero emissions was possible, and it was equitable as well. Sitting behind that roadmap, we had fact sheets for 68 different countries, and that went down into the granularity of exactly where emissions were coming from. So we could tell you where the emissions for energy were, for transport, and within the supply chain, we could look at food, we could look at pharmaceuticals, we could look at business services, and so on. So that really started to give us a really solid grounding. We're building on what was in the climate footprint report, and we can see where the big hotspots are, and we can see for more countries. So for 68 countries, we can actually start to see where those emissions are coming from within the healthcare sector. Now, again, that's a global roadmap. It provides us with a very kind of broad overview of those different countries. It uses single data sets to be able to demonstrate what's happening within those countries. So there was a very kind of natural next step to take with this, and that's where the Operation Zero project really fits in. And ultimately what we're trying to think now is, well, what can countries do themselves? What data sets do they have access to? What information do they have that we don't have? And how can they come up with something that is even more directly relevant for their own national context? And that's where the Operation Zero project came from. And so ultimately, the vision of the project was that every country in Europe commits to delivering net zero healthcare. But in doing that, they need to develop a national decarbonisation roadmap for their healthcare sector that charts a Paris-compatible course to net zero emissions. And when we're talking about emissions, we're talking about all emissions here. So it's not just scope 1 and scope 2, we're also looking at the really hard to hit scope 3 supply chain emissions. So ultimately, we're looking to, whether we're doing this as a kind of standalone process, and we're looking to build those broader climate commitments within individual countries and or regions as well. And so ultimately the objective of this project was to develop and pilot a methodology that can be applied by any national or regional health authority so that they might produce a carbon footprint for their own healthcare sector and chart their course to net zero emissions. The project wasn't about garnering commissions, it was about developing a response to commitments that are being made by countries. It's about the next step and it's about taking action. Now I should note as well, this is founded on an innate understanding that every healthcare system is different. They're organised and regulated differently, they've got different challenges and opportunities, and they're funded differently. We've got private, we've got public and so on. So we've got these unique footprints, if you like, from each national or regional healthcare system. So what do we mean when we talk about a methodology? And the document is available on our website, and I'm sure there will be a link for that dropped into the chat as we're going along today. So please do keep an eye out for that. But ultimately what we're talking about here is a document that contains a guiding set of principles and methods that can support a health authority in developing a roadmap. And that's a roadmap for net zero emissions. So first of all, it needs to calculate that carbon footprint. It needs to come up with some projections around where emissions are going to go in future, and therefore what needs to happen in order to bring those emissions down. I reiterate, this is intended to be used by any national, regional, or potentially a municipal health authority, and it has been drafted in such a way that it can be applied in any context. Now, to develop that methodology, we partner with a number of organisations, all of which are here today to give their own accounts of what's happened. So just to give a quick summary, again, all countries are different, all the needs and approaches are different, and there's all these different nuances. So that was really important to bring that into the project, and we see that across the different partners that we have here. It's been a collaborative project, and it's been developed and tested within each of these partner contexts. So we have Arup, who we are going to hear from next, who are going to go into more detail around what the methodology is and how it's applied. They're our technical partners. They're a London-based multidisciplinary consultancy firm, lots of fingers and lots of pies, but particularly for this, they're working quite heavily in the climate and sustainability spheres. We've also got the Ministry of Health, Welfare and Sport and the National Institute for Public Health and the Environment from the Netherlands. We've got the Central Administration for the Health System from Portugal. And in Italy, we've got a regional authority. We've got the Department of Epidemiology for the Lazio Regional Health Service. And I'd like to say each partner's played a key role in not only piloting the methodology, but also in steering its construction. So they've all through this process guided what goes into that methodology document. So again, different countries, different health systems, different contexts, different data sets, a really uniquely collaborative approach. So we are going to hear from Arup next, just on the kind of technicalities of the document, and then we're going to hear from each of the partners as well on their experience in applying the methodology and working through this project. I'm going to stay fairly high level, so I just wanted to quickly cover where we are at the moment in this sphere and really kind of pinpointing why this is important. Why is this methodology, why is this document needed now? So last year, and the kind of fallout from last year, and particularly COP, has been a really kind of pivotal moment for the health and climate sphere. So at COP26, we saw the first ever health pavilion, and we saw the COP26 health programme, where over 50 countries have made commitments to both low carbon and climate resilient healthcare. We've got 9 countries in Europe signing up to those commitments. And so we have Belgium, Denmark, Germany, Georgia, Ireland, Netherlands, Norway, Spain, and the UK. And they represent, in fact, the figure is now over 60% of healthcare emissions in Europe, which is huge. And so the commitments have been made. So now it's time to plan and act. Those governments are going to need to take action. They're going to need to calculate their footprints, and they're going to need to come up with some kind of plan to reduce those emissions. So just to kind of final off from my side, before I hand over to Arup, I just wanted to make a few kind of final remarks. So as I said before, the methodology has been developed in collaboration. It can be applied by any national, regional, or even municipal healthcare authority. And obviously we want to encourage that adoption. I always hesitate to use the word standard, but that is the kind of approach that we're taking here. Countries can apply this. They can apply a fairly common approach to developing their roadmaps. There is a need across the board for increased collaboration, building a community of practice and so on, and sharing those learnings and sharing that best practice. And that's partly what this is about today as well, being able to hear the testimonies from each of the partners that have been involved. We need to build on the momentum that we've seen from COP26. The methodology provides a platform from which we can build to the national level roadmaps and action in Europe. And we need to keep going with that. And then finally, just before I go off and hand over to Arup, I wanted to thank each of the partners involved, because quite frankly, it wouldn't have been possible without them. It wouldn't have been anywhere near as successful without them. And it's not been plain sailing. It's been challenging. There's been difficulties along the way. And you'll probably hear about some of those challenges as we hear from each of the partners. So I think a big thanks go out to them for making this such a kind of a process that was completely manageable. There was hiccups along the way, but it was manageable hiccups. And relatively painless, thankfully. So a big thanks again to all the partners. And with that, I'm going to hand over to Anna and Ben as well, from our technical consultants, Arup, who have obviously kind of played a big part in the technical part of this, and they're going to introduce the methodology document in a lot more detail. So thanks, Anna. I'll hand over to you.
Great, thanks, Scott. I'll just share my screen and then we'll get started. Fantastic. So lovely to have so many people join the call today. My name's Anna Tuddenham, and I'm presenting with my colleague Ben Ashby. We're both senior climate change consultants at Arup, and from this project's perspective and Arup's perspective, I led the project. I was project manager on our side, and Ben provided sort of comprehensive inputs to the development of the technical methodology. So to get started, I wanted to first set out the aim of the document and who it's been designed for. Primarily, we designed this methodology to give national or regional health authorities a one-stop shop to start a programme for health system decarbonisation. In terms of its primary audience, therefore, the methodology has been designed for use by analysts working within national or regional health authorities who have experience in calculating greenhouse gas emissions inventories or working with complex data sets. Now, we also appreciate that policy development is key to driving action in decarbonising healthcare emissions. Because of this, we've designed the methodology with a secondary audience of policy officials in mind. The document can be picked up by this audience working with the national or regional health authorities in a targeted way. And these individuals may find specific sections, such as developing appropriate governance structures and convening relevant stakeholders, useful. Now, as Scott mentioned, but just to emphasize, in terms of the reach of the methodology, it's really important to acknowledge that this has been drafted in such a way that it can be applied to any context. As you will hear later on, we've piloted it with a range of European countries and regions. However, it has been designed for global reach and it should be used as such. Now, looking directly at the document itself, the methodology has been structured to take the user on a journey. The flow diagram here, taken from the methodology, presents the overarching structure of the road mapping process. The numbers cross-reference the numbers used in the methodology sections. At each step of the process, we present a workflow, set out key guidance, and define outcomes that the user will achieve by following these steps. Now, I'll briefly walk through each of the steps in the figure here to set out what they will cover and lead to in outcome. Starting with establishing governance structures, the user will read here about the method for understanding the structure of the healthcare system, key stakeholders and existing policies, how to develop a governance structure, and how to include a process of continuous improvement within this. Moving to setting a baseline, the user reads about how to define the study boundary conditions, the data required and the process for top-down and bottom-up calculations, possible reporting frameworks that are available, and consideration of data quality. Moving down through the flowchart to deriving a trajectory step, the user here looks to understand key considerations when setting target trajectories, the future trends that can inform these trajectories, how to derive a national target, and the approach for downscaling the budget from national to subnational scale. In the creating a projection step, the user then understands how to source projections to use in scenario analysis and how to use expenditure data to explore emission scenarios. Moving further to modelling actions and pathways, the user can then understand how to frame and test interventions, assess the reduction potential of these actions, calculate the emissions gap, and see the post-processing techniques available for communicating to stakeholders in an effective way. Finally, the user then finds guidance on the framework for reporting, measuring, reporting, and verifying, and can see an example structure for a decarbonisation roadmap that can be adopted and moulded to the circumstances. As you can see in this figure, stakeholder engagement sits along the side, and it's critical to achieving these outcomes. I'll now hand over to Ben, who will look at 3 key takeaways from within the methodology.
Thank you, Anna. Hi, everybody. Sorry, my internet's a little bit slow, so do let me know if you can't hear me. So yes, in the running of this program, a few key lessons emerged. Firstly, the success of this program really rests on the engagement of key stakeholders within and external to the health sector. So these stakeholders make up the data holders, policymakers, suppliers, and interested parties who can contribute to the production of and be in the audience for a decarbonisation roadmap. Within the health sector, you've got facility managers, finance and supply chain teams, and these will hold data on the scale and nature of operations, which can help to inform a detailed and accurate baseline of emissions. And then upon this baseline, action can be taken. While practitioners will need to continue to deliver high quality care as the healthcare system decarbonises. Outside the sector, key stakeholders include government and health ministries, who will represent a key audience for the methodology and who have the means to drive a programme and coordinate the gathering of health data for use and modelling. Manufacturers and suppliers to the health system, who may provide data on the emissions associated with their goods and services, and who are also likely to be impacted by the policies and procurement standards that the sector puts forward as it looks to cut emissions. Also, you've got the policymakers and supplier industries. So as other industries seek to cut their emissions and produce their own targets and requirements, the health system as a major consumer of goods and services will carry significant influence in this process. Next slide, please. So when looking to produce a model and gather data, we also had a few key learnings. So firstly, this methodology provides a frame of reference for model creation. It does not provide instructions to produce a model. And this is really reflective of the fact that every health system in every different national context is different. And there is different data available to the teams in each of these locations. So depending on the context and the data available, then the model structure will make use of a few different types of data and input. So we'd expect high-level top-down reporting at the national level, coupled with expenditure data sets to play a major role. But also, as you're able to get into the your stakeholder networks and engage your key data holders, you can start to bring forward detailed operational data on the quantities of specific goods and services which are used. And that will allow you to bring a lot more detail and certainty to your modelling and allow for more targeted actions on key product and supply lines. And lastly, really, the model shouldn't be static. So I think, as Anna highlighted, there is a continual improvement element to this. So as new data sources and methods become available, you can kind of improve and add detail as you kind of look to re-baseline and track progress. So your first baseline will really make use of the data that's available in the first instance, and it shall identify the major key opportunities for gathering better data. Once the stakeholders and data holders have enabled the collection and kind of processing of these data sets, you can use this to re-baseline and improve the model and then really kind of narrow in on the areas where there's the greatest opportunity for change. Next slide, please. So yeah, lastly, I just wanted to give a picture of what the methodology can deliver. So once the difficult tasks of gathering data and establishing a baseline are in place, it's possible to really extend these models, looking at future scenarios and exploring the impacts of policies designed to really deliver transformative change. So the method proposes the means by which the sector can set a target trajectory for emissions. So looking at progress from the present day to a net zero health system by 2050. Once this is in place, we can assess future growth and decarbonisation trends in the global economy and look at these kind of various projections to pull together a range of scenarios that can help inform action. So to start with, you can combine forecasts for change in demand with a picture of what the current level of climate action is, and you can use that to get a business as usual scenario for your emissions, and which you can measure the impacts of different policies against, and it gives you a picture of where you are headed without further action to tackle emissions. On top of this, you can start to look at different trends in the supply chain and the global economy and targeted actions from within the sector, looking at your facilities and operations, your supply chain emissions, and then how the role of healthcare in influencing wider society and pushing for a quicker rate of change in the global economy. So through these scenarios, it's possible to really bring forward the strategy for achieving a net zero health system at the national level, and for really testing the level of opportunity of a whole range of different policies and interventions. So before I hand over to our other partners in this project, I just want to say it's been a fantastic initiative for all of us to be involved in, and it's really exciting to see where this goes in future. So with that, I will pass over to the partner countries who are going to talk about their experience using the guidance.
I'm Lucia from Portugal, and I will make this little presentation about the implementation of the methodology in the case of the Portuguese health system. At first, we started by calculating our baseline emissions. We made this calculation for the whole health system, including both the private and the public sector. And we make this baseline calculation for 2014. We used a hybrid method as described in the methodology documents, and a lot of databases. And as a result, we got some numbers. Our greenhouse gas footprint of the whole health system was represents about 5.7% of the total emissions at the national level. Most of these emissions are from the supply chain, are scope 3 emissions, and 14% are direct emissions, scope 1 emissions. So the next step was set a target trajectory for the health sector future emissions. We created the target trajectory considering the decarbonisation trajectory defined by the Portuguese government for Portugal. So we created the 2 target trajectories, one for the whole system and one for only the public health sector. These trajectories are represented here, and we assumed that we have to respect these trajectories through the next year till 2050. After creating the trajectories, the ideal trajectories, we created some projections of the future emissions from our health sector. We make these projections for 2025 till 2050 for every 5 years. We use it also a hybrid model and data about the decarbonization of the economy for the next decades. And the projections results show us that in 2050, without taking any additional action from the health system, we will we will reduce our emissions in 42%. But this reduction, the reductions that the projection that we got through the projections we made were not enough to meet the target trajectory for the whole system and for the public health sector. So we know that we have to take some additional actions because the gap is significant between these two lines, between the projections and the target trajectory. So the next phase that we modeled the implementation of measures to reduce the emissions of our health system. As we are representing the Ministry of Health, the measures that we modeled were modeled only for the public health sector. And we have some targets for sustainability in our public health sector. we have a program that is called Eco Saúde, and this program establishes some targets, reduction targets, that the public healthcare entities had to meet till 2030. So we assume in this modeling, we assume that we will meet all these targets, and the objective was see what kind of reduction, what kind of improvement we will have in our emissions. We have, so these targets to which our healthcare entities are they have to accomplish these targets, and these targets are about energy efficiency, reducing the energy consumption, reducing the water consumption, reducing waste production, and increasing the self-consumption through renewable energy sources. The targets, the EcoSaúde targets, can influence Scope 1, Scope 2, and Scope 3 emissions. But the degree of influence is low, is relatively low in the total footprint of the health sector, the public health sector. We have here, we show the evolution of the emissions regarding the values of 2014, the baseline year, and we have a little improvement in the decarbonisation comparing to the projections that we made with no action from the health sector. So we continue to have a significant gap between the target trajectory and the projected emissions. This time with the targets, EcoSaúde targets, this reduction targets. And our conclusions are that there are two main sources of emissions in our health system, that are chemicals and pharmaceuticals consumption. They represent 40% of the total greenhouse gas emission footprint. And the EcoSaúde reduction targets, the targets already established by the government, can't influence those emissions, and the great majority of indirect Scope 3 emission sources. So we have to decarbonize the supply chain and of the public health sector. And this is essential to meet sector's target trajectory, the target trajectory created in this study. The Portuguese public health sector need to make a comprehensive approach to its emission, an approach that goes beyond the EcoSaúde program and goes beyond these targets already established for the improvements. Conclusions of the participation of being part of this study. We were able to calculate our baseline greenhouse emissions that we didn't know till the moment. We projected the future behavior of the health sector emissions, and studied the effect of the measures we already have the EcoSaúde measures, the EcoSaúde targets, and we identify areas where we, the central administration of the health system, can't exercise a direct influence, but which are core in the health system decarbonisation process. Mainly the scope 3 emissions. Regarding the main difficulties, the method has a large, we have to apply to the method a large quantity of assumptions. Since we use it mainly a top-down methodology, there are missing data for some emissions, and applying this methodology is a complex process that takes a lot of time and have to be made by experts for reducing the time that we have to spend with this work. This methodology is not harmonized with the calculation of emission used at the national level, which is based on the geographical criterion, and we think this should be harmonized in the future. The way that countries show and calculate emissions should be harmonized, so that we can use all this study in a better way. And it's all. I will pass to Michelle from Netherlands.
Thank you. Let me just share my screen. I think you can all see my screen okay now. Hi everyone, I am Michelle. I work at the RIVM, which is the Dutch National Institute for Public Health and the Environment. And I will share my experience in the following minutes with Operation Zero. I am a researcher, circular economy and sustainability at the RIVM. Just a bit of background on the momentum of footprints analyses for the healthcare system. In the beginning of 2020, we started our footprint analysis of the impact of the Dutch healthcare system at the RIVM, and this was in response to more and more evidence showing that the impact of climate change, or climate change has an impact on the healthcare and the public health. And also this was in context of the initiating of the Green Deal Sustainable Care initiative in the Netherlands. So with the question of how can we reduce the impacts of the Dutch healthcare system, because eventually the environmental impacts caused by the healthcare system would affect public health, affecting Dutch healthcare. So, and in addition to this momentum, of course, there was the COP26 health commitment to the WHO health program. So in parallel to already having been started to start calculating the baseline footprint for the Dutch healthcare system, we've collaborated with Operation Zero. This was very valuable to us to validate our work on the baseline footprints, to brainstorm with those practitioners that are working on the same topic, basically a community of practice, talking about the same struggles and how we can help each other to tackle them. And I think this kind of community of practice with colleagues in other countries is very, very useful in these kind of exercises. Even though the exercises are not completely the same as been discussed before. You really can help each other out with any kind of struggles with this. And also what Operation Zero provided, or the methodology provided, is other things that you can use with your baseline models, such as carbon budgeting or including a carbon budget in your projections, and also more importantly, use the tool for scenario modeling. These last two things we were not able to do ourselves because of time constraints, but it's something that we really like to also implement in the future. Let's see. So these past years have been really focused on solidifying our footprint methodology, and this, well, here we can already share some the results. One thing that we did, which is a bit different, is that we also wanted to calculate the impact of other impact categories, such as research use, water use, land use, and waste production, amongst many other things that you can also consider. This basically can be done with the same methodology. So you can also steer with not just to climate change as an impact category, but you can also use this for other impact categories as well, with maybe slight changes here and there, but overall you can apply this for multiple impact categories. For this case, for us, we found that around 7%, or the Dutch healthcare system is responsible for 7% of the contribution to climate change from a national level. And also what was interesting to see when you consider multiple impact categories is that in our case, in our initial results, pharmaceuticals and other chemical products such as disposable products are responsible for most of the impact in multiple impact categories, which was really interesting. So less so in the climate change impact category, more so in the other impact categories. And also what we found interesting is that, for instance, food and catering is a relatively small part of the climate change impact, but is more prominent in impact categories such as water use and land use and waste production. So those are initial results, and later in this presentation I will also show you where you can read through our methodology, because we've documented everything, and we will publish it quite soon, in a few months. What is important to share is what we see as the value of creating such a footprint like this. And first of all, we really see this as a very useful prioritization tool. We see in our daily work from healthcare professionals, but also policymakers, that there's a lot of initiatives, there's a lot of creativity. People are very aware of the impact of the Dutch of the impact of healthcare on the environment. But then again, there's this question of, but where should we start? We can do all of these things. Where do we start? And if we focus only this, would this be just a drop in the bucket? And should we maybe focus on the impact or focus on something else that has more impact? So this can really be used first and foremost as a prioritization tool, and also for prioritizing data gaps. So we also, with this exercise, we know what we don't know, or we don't know for sure. And this is very useful to steer research in certain directions to improve this model that need to be investigated more, or should be what the implications are, should be investigated more. And lastly, one of the other end benefits is harmonization across all research. This baseline footprint can really be used as sort of a common goal setting and setting common definitions, because that's also kind of an issue with sustainability, not just in healthcare, but in general. So what is the system boundaries? What are the definitions for sustainability, etc.? And to anchor follow-up research or future bottom-up analysis, for instance, anchor that to this baseline footprints. There are so many new initiatives, so many new bottom-up data analysis or data gathering At least with this baseline footprint, you provide kind of a reference, and you can also sort of provide a protocol to make sure that all the new bottom-up data analysis are more or less comparable to one another by using the same characterization factors of the type of greenhouse gases, for instance. Of course, there's also challenges that have been discussed before. One of the challenges for us is that for some product groups, there's a high level of aggregation, which is one of the issues, of course, with top-down modeling. But some product groups are too high level to make them actionable. We need to make them more actionable by disaggregating them in the future. Also, hybridization. So what do you do with more and more collection of bottom-up data, which is good. You should encourage bottom-up data to be collected, but how eventually can you sort of merge the top-down and bottom-up data? There needs to be some sort of protocol, which does not exist at the moment. There are many ways to sort of merge these type of data. And of course, you have to deal with uncertainties. A few months ago, there was the meeting, also WHO meeting, where someone from the NHS carbon footprinting initiative said that don't let the perfect be the enemy of good for such a carbon footprint, because this will be like a long process. You will improve it by year, which also requires some kind of flexibility and not have everything set in stone, and just keep in mind that the carbon footprint will have uncertainties and will improve in the future. Then lastly, in short, I will discuss the work that we've done and how we documented it for our baseline footprint. So first of all, we have documented our environmental footprint for Dutch healthcare in a preprint, which should be, well, hopefully gets accepted soon for publication, but also a very a big RIVM report, which would be published in English in October. So keep an eye on our website, which I shall later for that. Also, one of the kind of spin-offs that started from this research is that we've also now collaborated with the community of general practitioners to write an article on the environmental impacts of pressurized metered dose inhalers, which was initiated by the footprints analysis, and which also considers pressurized metered dose inhalers. Also, from the results, we saw that pharmaceuticals in our model results in the biggest contribution to the environmental impact, which is now starting to. We also did more work on that by doing a meta review on all the literature available on the impact of pharmaceuticals, and also did a review of predictive models to assess the impact of pharmaceuticals, which would be partially also included in the RIVM report. And lastly, we would like to really also start the scenario modeling. Hopefully by the end of this year, we can produce that in the form of a fact sheet. And there are many more projects the RIVM is doing related to the how public health affects climate change and vice versa, that are too many to name. With that said, if you want to know more about our work, you can contact us through our general email address, duurzamezorg@rivm.nl, or you can contact me. And also, if you want to keep in touch with us or be updated on our work, we have a website, rvm.nl/Green Deal Duurzame and that's it. Let's see. Let me stop sharing and give the floor to Francesca. Yes.
Thank you, Michelle. Good afternoon. Well, good morning, everyone. It's a pleasure to be here. I'm very briefly going to present our experience from the Lazio regional case study on defining a roadmap to decarbonisation of the health system. I'm Francesca De Donato. I work at the Department of Epidemiology here in Rome in the Lazio region. So we had a slightly different take compared to what you've seen before. I don't know if you're seeing the full screen, actually. Hold on a second. Okay, so sorry about that. As I was saying, our take is slightly different. We have a very public health perspective on how we approach this. As we've heard before, climate change is impacting not only on our environment, but on our health. So adaptation and mitigation measures really need to be implemented, taking into account the leading role of health, both when defining mitigation measures in terms of the health co-benefits. So whatever measures we take for reducing emissions, for example, need to take into account the benefits for health, and we should be moving towards those that have greater health co-benefits. And in terms of adaptation as well, we should move away from the silo approach of responding to climate change and thinking of health in all policies. So not only for what health impacts are, but also in terms of climate policies and addressing what other health co-benefits they can have from response to climate change. So our objective obviously here was to estimate the healthcare emissions and develop a decarbonisation roadmap, which is compatible with European national and regional policies. So really drilling down into what the policy take was and where we currently stand and how we can improve let's say the uptake also from a health perspective when we're defining different policies. So not being just standalone emission targets for energy or for transport, for example, but also having an impact on the health co-benefit, which is something that isn't really being addressed and which the European Commission has invested on recently, as well as WHO, really trying to make sure that all climate policies are not only addressed on emissions and on other aspects of the environment, but that health really has a leading role, because if not, it's sort of left on the side, which means, on the other hand, that in terms of health policies, climate and environmental issues aren't really addressed and they're not really encountered in future policies or in future financial schemes as well. Having said that, just to give you a bit of background of where we're setting it, where we are, the Lazio region is in central Italy, as you can see from the map. It's a relatively large region. We have over 5.8 million people. It's quite old, as most European countries, but even more so regarding us in Italy. Over 22% of the population is aged over 65. Life expectancy is nearly 83 years of age. And 40% of the adult population have at least one chronic disease, as you can see from the figure on the bottom right-hand corner, mostly, as we know, diabetes, hypertension, cardiovascular and respiratory disease, which obviously has an impact in terms of who the most vulnerable to climate stresses are and how we can reduce future impacts as well on the actual population. In terms of the Lazio regional health system, some background, obviously it's a universal public healthcare system which is devolved on a regional basis and administrative by the regions themselves and coordinated by the Ministry of Health. The main source of financing is national and regional taxation and implemented by co-payments from pharmaceutical and outpatient care. In terms of our region, we have 10 local health authorities and together these have several districts for a total of 55. There are 60 hospitals which are managed directly from the Public Health Service and over 500 health services that complement the hospitals. And together with that, we have also co-shared or outsourced 900 private and accredited hospitals and healthcare services. So it's a quite diverse setting. And again, as you can see from the map, Rome is the capital of Italy. It's a very urbanized center with over nearly 3 million inhabitants, but we also have very rural settings as well, an industrial port, several regional industrial settings which are relevant, such as the pharmaceutical industry, energy provision, and other sorts. So it's quite different, and the setting from the healthcare sector are also diverse in that context. So just our take on this was to really drill down what were the existing policies before we actually moved into the nitty-gritty of calculating our scenario and our, let's say, our roadmap and our baseline conditions. We really wanted to link to the existing policies because we are in a very particular moment where we are seeing very important changes in substantial financing as well. If we think of COVID recovery, climate policies at the EU level, from Green Deal and the new climate action. So at regional level in our region in 2021, a new strategy for sustainable development was provided, in which we really wanted to collaborate with the definition of the different goals, really pinpointing down what the health co-benefits could be. And so really bringing this topic on the agenda as well, which originally isn't set to be so, as we all well know. If we think of other policies that are relevant in this context, we can think of, as I said, of the EU recovery funds after the COVID pandemic, or in the meantime of the COVID pandemic. Italy has two main plans, which are the PNRR and the PNC, which focuses on digital transition, green transition, economic and social resilience, and in terms of health specifically, improving healthcare services and modernization, digitalization and e-health, which can also be linked to this context of defining a roadmap for decarbonisation, improving the sustainability of the public health system and health services in general, as well as improving the health and response to climate change and sustainability and resilience in a wider perspective as well. Another important regional law which was passed last year in 2022 was the Region Energy Plan, which revised the reduction in CO2 emission limits and goals, the reduction in energy consumption, and the proportion of renewable energies. These don't specifically address the public, the health system or the health sector, but to some extent we can link to this as well in terms of health effects, both in health effects, so looking at, as I said before, to the co-benefits of reducing emissions, in terms of health impacts on the Lazio region. This is something that we're working on together with the different sectors, as well as addressing this in terms of public health sector emissions. And finally, another aspect, which is health, which usually sits in another silo and doesn't really relate to climate change at all. While in recent years, the National Prevention Plan for 2021-2025, so a 5-year plan, was issued in 2021 and adopted then regionally, for the first time really addressed climate change in terms of the environmental issues related to health, for health promotion and prevention, promoting equity and different aspects of health. And this is really relevant because it means that even the healthcare sector can have a say and really address this aspect, and defining a roadmap can easily feed into the different aspects of this, as well, as you can see from the figure, which I won't address specifically. So where are we? Where do we stand from the initial work that was carried out by Healthcare Without Harm and Arup? This is where Italy sits in terms of health sector emissions. As you can see, the Lazio region more or less has 9% of national emissions, and this is where we started off in our framework of where we stand for our calculations. In terms of the operational steps, as I said, we had more of an initial take looking at mapping the policies, identifying the gap, and really having this as an uptake when we're thinking of reducing emissions and thinking of the decarbonisation, before actually really diving into the data collection and the baseline calculations or the trajectories, in order to ensure that something will actually happen. Because let's say Italy has a very Mediterranean or different approach compared to, for example, the Netherlands. If there are no policies to link it to, then it will just be an exercise carried out more as research, and that is not what we wanted. So our idea from let's say consultants or experts on health was to really include it in all the policy tables that we sit on in terms of climate change, emissions, or greening of the economy. And the other aspects, let's say, really do follow the trajectory that was designed by Healthcare Without Harm in the Net Zero Roadmap. In terms of challenges, what we found, one of the main difficulties was finding all the different contacts and stakeholders, because we really wanted to start addressing and listening to everyone's perspective, finding out the issues, and then being able to drill down into the different sectors of those emissions, as we've seen from the previous presentations. So retrieving all the regional health expenditure data in the format that was required with specific detail, again, was something that we really wanted to focus on and we've been working on. Another issue was, as was mentioned before by both Lucia and Michelle, was aligning the healthcare expenditures with emissions inventory and looking at defining the baseline year and the study period to then define the model choices and the future trajectories as we go along. Throughout this, obviously, creating and having the momentum of the network was another challenge, especially if we consider that in the last 2 years, we've been really fighting with the COVID pandemic, which has hindered actions and collaboration through this, especially within the healthcare sector, as you can imagine. The Lazio region was also hacked throughout the first year of COVID, and all our data and all communication and everything else was really a challenge. So that definitely didn't help in this year and a half. But again, I think it's a great opportunity in terms of stronger policy framework and action and collaboration that has been set up not only at EU level, national level, and within our region. So this really sets the basis and the stepping stones to carry this work out in the next coming years. In terms of the next steps and where we are, we're finalizing our calculations and future projections. We are having an intersectorial group discussion with the different aspects and defining the different actions within the current policy framework. We have also introduced this aspect within the current and policy frameworks in terms of evaluation and monitoring, because this is a crucial aspect. We don't want it to be a standalone exercise. We really want to make sure things are progressing. We can change them along the way, and they are evaluated in the different action plans and policies I showed before. What we will be doing is, again, is defining in-depth calculation for single local health authorities, because these are very different, as I explained before, throughout the Lazio region for their different geographical setting, the health system characteristics. Rome is very different in terms of urbanized characteristics compared to hotspots we have across the region. We have some major industrial and polluted sites which need to be addressed differently and have specific characteristics. And again, we would like to address extreme events. For example, heat waves this summer have been a major issue, and this has an impact on public health expenditure, as well as COVID as an example of what can go wrong and how can we account for this when we're doing our projections for the future. What might happen if we have these extreme years in terms of public health spending? As you can imagine, this would really change things. The Lazio region has also been in a repayment plan up until a few years ago, so that has also hindered or changed how we would like to evolve the future of the public health system, but it has also given us some indication of where we can really cut down expenditures and improve management and operation as well. So these will also be included in the different scenarios and create more ad hoc scenarios for the future for the different single public health authorities. And that's it from me. Thank you very much.
Thanks, Francesca. So thank you to all the partners been involved. It's really great kind of hearing that live experience. And we're running a bit over time, so I'm going to compress the Q&A a little bit, but there are some really nice questions in the chat. They have been answered as we've been going along in written format, so do take a minute just to scroll through some of those answered questions. But there are a few ones that I would I'd like to address with some members of the team. So as a moderator, I'm going to take some privileges here. So I'm going to put my first question to Lucia. So we noticed, and I'm sure others on the call have noticed as well, that your current target, your current plan doesn't take you to net zero emissions. I wonder if you can go into a bit more detail around that. I'm sure there's been some challenges there, but maybe you can elaborate on why that is.
Yes. In the central administration of the health system where I work, we work in the field of the facilities and equipments of the health system. And we had some limitations to assume measures, in this study measures that goes beyond our field of work, that are the facilities and equipment. And we through the calculations of the baseline, we see that the main emissions of our health system are from the scope 3 emissions from the supply chain. They are mainly from the consumption of chemicals and pharmaceuticals. And we cannot, in our field of work, we cannot assume measures, taking specific measures in this fields of supply chain. But we know that through this study, we noted that these are essential areas of emissions, and we will try to, in the future, we will try to, together with another entities of the Portuguese health system, we will try to take some action on these issues, because now we know that they are real problems, and that we have to do something besides the measures of the EcoSaúde program, but because they are not enough to achieve the zero emissions.
Great, thanks you, Lucia. So that's really helpful. So this is really about your kind of level of influence within the department that you work, I think, and just how far you can take that. So I think it really kind of highlights that to reach that net zero, it's going to take a comprehensive view right across the healthcare sector, right across your colleagues and so on, yes, to be able to deliver that. So no, that's great. Thank you very much. So the next question we've got here, I'm going to put one to Vladimir. And if the speakers want to turn on their cameras, they're free to do so, just so we can see you. But next question is for Vladimir. So with so many hospitals and kind of institutions within the healthcare sector moving towards environmental sustainability, are you aware of any kind of EU certifications that are in place or being put into place that might kind of support mitigation measures?
Probably this is a question need to be, if you think on European Union countries, probably the question need to be addressed to European Commission, because in our WHO European region, we have 53 member states. So we have more countries than the European Union. But as far as I know, the ongoing activities regarding engagement of the particular on regions and local authorities who joined to the EU mission for adaptation to climate change, and I'm not sure about the certification of whatever measure regarding the hospital and the level of hospitals or healthcare facilities. But what we do in WHO is that we have the biannual collaborative agreement with the countries, and under these activities we agreed, and recently in Poland we organized the workshop with the healthcare facilities within the region of Poland, with participating, and they promote other activities. So there are no such kind of certification, at least on our behalf, but it's very important to be addressed at the Ministry of Health, because I assume that the Ministry of Health needs to be aware of and needs to support such activities, because they need some funding, and there should be definitely some sources and planning the budgetary plans with different owners and different layers of activity. As far as I know, I don't know about the certification, but as I said, there are ongoing activities, and it should be a country-driven, not some general EU or whatever WHO certificates on this.
Thanks very much for that, Vladimir. So I'm just very conscious of time. So I'm going to ask one more quick question. It's been directed towards healthcare without harm, but I'm going to bring Arup into this just to be difficult. So just very quickly, I guess, that the way the methodology has been drafted, it appears maybe, or maybe it's through the presentation of it today, is that it's kind of dependent on the current state of play. But many would argue that we need a kind of paradigm shift in how we deliver healthcare. So thinking rather than moving away, to say, from curative care to more preventative care and so on. So can we have a bit of comment around whether the methodology supports that paradigm shift? I mean, I'm thinking, kind of Anna and Ben, that this is really around how we model. So we include within the methodology document the kind of modeling exercise of what emissions are going to look like in healthcare. So my thinking here is that to be able to incorporate that paradigm shift, moving towards preventative care, it's going to be about how we model our future healthcare trends and so on. But maybe you guys can provide a bit quick comment on that.
From my point of view, I think it is very possible. I think, as always with this, it comes down to the level of data that you're able to access. If you're, for example, able to track the amount you're spending on these diseases that are preventable, and then you can use that as a lever to test the potential of actually, avoiding this burden of disease through kind of preventative healthcare measures, that is one way of tracking the potential of this paradigm shift. And then otherwise, this kind of active rebaselining should always provide an up-to-date vision of where the health system is currently at, how it operates, and where it spends. So as the method of healthcare delivery shifts, so too will the model in response to that, as long as the data is up to date and reflects the means by which healthcare is delivered.
Scott, may I add a very quick point to that? I would just summarize that absolutely, yes, the methodology can be used to explore those paradigm shift, let's say, interventions that one might want to take. And if you want a taste or sense of how to do that, and of course, the methodology has been inspired by this. It's the work that you talked about earlier in the global roadmap, where some of those preventative aspects or exploratory into those realms has been looked at and examined. So in essence, yes, it can be used to do that.
Great, thanks very much, Christian and Ben. So with that, I think we're going to close off now. So I apologise to anyone whose questions we haven't managed to answer yet. But my speakers, please do have a look in the chat. There are some questions there that you can maybe answer in writing. But with that, thank you very much. And I'm hand back over to Will just for some closing comments.
Thanks, Scott. Yeah, happy to do so. And what a great session. So, I mean, it was great to hear from Vladimir at the beginning there about the global perspective and context and the importance of health sector action on climate, and also the co-benefits, of course, on health and climate action. And we saw questions about that in the chat. And then, Scott, it was great to hear about the background and the evolution of Operation Zero and how it's been developed, and from Arup on the kind of nuts and bolts on how it works. But I think the key thing for us all was hearing about how this has been used in practice. So from our three health authority partners, who presented very, very different approaches. There are different stages in this journey, and just showed how it can work at different levels and be applied in different ways and at different levels of maturity. So I think that's really what we were trying to do with this. And it's really just about lighting the way forward. So I think, it's key to understand this is an iterative process. There are going to be uncertainties. But you need to start somewhere and trust the process will become clearer and more accurate as you go forward. I think the other key thing we heard was about collaboration, and the power of collaboration across system boundaries. We're all on this journey together, and that was a key aspect of this project. The methodology is freely available. You'll find the link in the chat. We'd obviously encourage you to download it and use it. And, if you want to learn more about it or talk to us about how we can support you on your own journey towards net zero healthcare, obviously don't hesitate to reach out to Scott and his team. And with that, we're 1 minute over, so apologies, but thank you very much for joining us. Thanks to all of our speakers and, of course, our Operation Zero partners. And we look forward to working with you all on delivering climate smart healthcare in Europe. So thank you very much and see you soon.